Hi everybody, today is a video about some questions somebody's asking about order in which to treat things like mold toxicity, heavy metals, biofilms, and things like that. Just before I get into the answering the question, if you don't mind taking a quick second to like or share or subscribe or just post a quick comment on the video, I'd really appreciate it. So thanks in advance for doing that. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the question is, with mold toxicity, is it best to go after heavy metals, biofilms, and mold all at the same time? Do I think black cumin seed oil is a good phase 2 biofilm disruptor? And the person goes on to say they're thinking about using black seed oil, citrospectin, and carboxy by Cellcore, which is a supplement company. So generally speaking, with my patients, there certainly are cases where we're going after heavy metals, biofilms, and mold all at the same time. I'm a big fan, though, of phasing things in, typically one or two things, kind of variables at a time. It would be quite rare that I would say, hey, let's get on a mold protocol and go after biofilms and go after heavy metals all at once. I usually base the order of things based on, or I base it upon what symptoms are happening, how sensitive the patient is, what the timeline was like in terms of, did they start getting sick when they had mold exposure, or were they having some exposure to heavy metals, or did they have lots of symptoms suggesting that their detox pathways are really gummed up and mucked up and whatnot. So the order really depends in a lot of cases, but in many cases I would start with getting a mold treatment protocol in place. I mean, with going after biofilms, if the assumption where there's no mention of Lyme or co-infections or anything, I assume that biofilm references with respect to mold biofilms, likely forming in the sinuses, maybe in the lungs in some rare cases. But generally I get the mold protocol in place first, so the detoxification pathway support, fumigating the sinuses with some type of nasal spray, and then assuming that that's being well tolerated, then we see what's happening clinically, and if the patient's getting better and better, then we usually don't mess with the good thing a whole heck of a lot. If the rate of progress is very slow, then we'll speed things up, but if they're getting better in a nice efficient fashion, kind of wait until they're either feeling 100%, in which case we probably don't need to worry about going after biofilms, or if they hit a plateau, then we look at phasing in the biofilm disruptor, which would be switching up the nasal spray that they're working with, and then the final step, if it seemed to be needed, would be bringing in the heavy metal, doing the testing for heavy metals and then subsequent treatment if needed. So that would be a pretty typical series of events. Generally want to get after the mold right away. Mold has been described by other folks that I've heard lecture before as being like gasoline being poured on the fire that's set by other things that are happening in the body. So, if we're trying to douse the flames, we really want to get that gasoline out of there first. You're not going to put out a campfire if there's still a stream of gasoline being poured on it. You got to cut off the gas source before you're going to have a chance of putting out the flames efficiently anyways. So that's my answer to that part of the question. And then do I think the black cumin seed oil is a good phase 2 biofilm disruptor? So I know that it's in phase 2, like products that are like literally called, or there's a product literally called phase 2 biofilm disruptor or something like that, or phase 2 assist, or I can't remember exactly what it's called now. We get our phase 2 biofilm disruptor made by a compounding pharmacy, so it doesn't have a name. It's just called DMSA, alpha lipoic acid bismuth combo. It doesn't have an actual name. So I'm not sure how good of a phase 2 biofilm disruptor it is. My understanding of it from one of my mentors, Dr. Paul Anderson, who's amazing and brilliant. He has his own Instagram channel and YouTube channel. If you haven't heard of him, please consider checking him out. He's just really brilliant guy. He's been at it for forever and just lectures like to naturopathic doctors and functional medicine practitioners all over the place. So really brilliant. So my understanding from his work, and I don't pretend or profess to speak for Dr. Anderson by any stretch of the imagination, but my take-home message is that if we can get a chelator in our biofilm disruptor, so either DMSA or DMPS, that's the best. If we can't get that in the mix, because those are, in some states require a prescription, and you need a compounding pharmacy to put them together, and so there's kind of hoops to jump through that way. Then black cumin seed is kind of the next best thing to put in there. So I don't know, I don't use that one, but I assume it probably does have phase 2 biofilm disrupting properties since it's kind of used in lieu of those chelators, but I don't know for sure. But I believe that the chelators are stronger. So if that's an option, then that's the option that I go with for my patients. So thank you for the questions. If you have any further follow-up questions to that, please feel free to ask. If anybody else has any questions about this topic or anything else, please post in the comment section below, and I'll do my best to answer as soon as I can.